Hi, I'm Ava Tan. I'm one of the emergency and critical care specialists here at Massey Vets. I'm the criticalist here who takes care of the critical patients and the emergency patients, but also overall in terms of overall hospital care for the surgery patients and the very sick patients from the other departments. But on a typical day, we would start at 8 a.m. with patient handovers, so we get the new information from the new emergency patients that have come in overnight. We will also get updates about the inpatients from the previous day. And after that, we would spend the morning till about 10, 11 a.m. Looking at our inpatients, making sure that they're getting the right treatment, optimizing their management, getting them home if they're ready to go home. And at the same time, we will be receiving new patients in the emergency room as well. So it just really depends. Being an academic institute, we would also do a lot of student teaching. So we always have students around and we'll try to incorporate the teaching within our cases itself. So if an emergency patient comes in, we would do teaching with the students by a case side basis. But if things are fairly quiet in the emergency room, we would do cage side rounds with our current inpatients, and we go into detail about physiology, medications, and altering their treatment plans. So that's kind of the morning for us. The rest of the day, again, really depends on the flow of the emergency room. If there's a lot of emergencies or critical patients from the other departments, we would spend the rest of the day stabilizing them. But if we have a bit of time, we would then focus on more student tutorials where we would go into the basics of emergency to get the fundamentals right for them. Or the other option is we will also do very in-depth resident teaching where we go into the advanced theories and physiology, because what we're trying to do as specialists is also to teach the new generation of specialists so that they can keep the flow of this information through the years. So in terms of when my day ends, it really depends on how busy we are. Sometimes we finish at 5 p.m., but most of the times we're finishing whenever our patients are ready and stable. So we could be here at work till 8 p.m. depending on the patient care requirements.